What is dental amalgam? Dental amalgam is a tooth-filling material that is approximately 50% mercury. It is sometimes misleadingly called a silver filling, even though it contains far more mercury than silver. Mercury, a heavy metal, is known to be poisonous to the human nervous system. Dental amalgam. Health risks. Tooth damage. Environmental problems. Workplace hazards. Social injustices. There are still dentists out there who use this toxic mercury product, so make sure to say no amalgam before you ever sit in that dental chair. Ask for mercury-free fillings instead. Health risks associated with amalgam. When it comes to your health, amalgam can do far more harm than good. Mercury exposure. Dental amalgam is approximately 50% mercury, a known neurotoxin and reproductive toxin. Amalgam releases mercury vapors throughout its life cycle, especially when the dentist places their amalgam in your tooth. You chew food or gum. You brush your teeth. You grind your teeth. As a result, people with amalgam fillings have higher levels of mercury in their bodies than people without amalgam fillings. Vulnerable populations. Mercury exposure from dental amalgam is not safe for anyone, but it is particularly risky for children. Children's developing brains and neurological systems are particularly susceptible to the neurotoxic effects of amalgam's mercury vapor. The U.S. Food and Drug Administration (FDA) admits that there is no evidence that amalgam is safe for children. Very limited to no clinical information is available regarding long-term health outcomes in pregnant women and their developing fetuses and children under the age of 6, including infants who are breastfed. Many countries, including the entire European Union, are banning amalgam use in children. Women of childbearing ages. Mercury from a mother's amalgams can cross the placenta and accumulate in her unborn child. As mentioned above, the FDA admits that there is no evidence that amalgam is safe for developing fetuses. Many countries, including the entire European Union, Canada, Australia, and Mauritius, are banning or recommending against amalgam use in pregnant women. Breastfeeding infants. Mercury from a mother's amalgams can be passed to her infant through breast milk. The European Union is banning amalgam use in breastfeeding mothers. People with kidney impairments. Mercury can be harmful to your kidneys, especially if you already have a kidney disorder. Decreased kidney function. Decreased renal clearance is likely to decrease the body's ability to eliminate mercury via urine. Canada warns against the use of amalgam in people with kidney impairments. Genetically susceptible individuals. Recent studies found that some individuals are more genetically prone to suffer the neurotoxic effects of mercury from amalgam. For example, Woods et al. 2012 found significant adverse effects on neurobehavioral functions associated with chronic Hg. Mercury exposure from amalgam and the CPOX4 genetic variant among children, with effects manifested predominantly among boys. People with pre-existing neurological problems. Mercury is known as a potent poison of the brain and nervous system. If you already have a neurological problem, it would be risky to add neurotoxic mercury from amalgam on top of it. People already exposed to other mercury sources. Mercury from amalgam and other sources, like some fish, is bioaccumulative, meaning that it builds up in increasing concentrations in the body. If you are already exposed to mercury in your workplace or diet, the additional mercury from amalgam is likely to be more than your body can handle. People with allergies or hypersensitivities. The FDA warns against use of amalgam in people with allergies or hypersensitivities to mercury. As FDA's rule explains, FDA concludes that existing data indicate that certain individuals with a pre-existing hypersensitivity or allergy to mercury may be at risk for adverse health effects from mercury vapor released from dental amalgam. FDA concluded that various dermatological conditions or lesions of the skin, mouth, and tongue were attributed to direct or indirect contact with dental amalgam, and may have been related to pre-existing hypersensitivity or allergy to mercury other metals. People with other metals in their mouth, The FDA warns against use of amalgam when it would come into direct contact with other metals in the mouth, such as stainless steel, titanium, base metal alloys, and noble metal alloys. As FDA's rule explains, dental amalgam devices may corrode under certain conditions, including when they are placed in direct contact with other metals. If a dental amalgam device corrodes, it will lose its strength and will need to be replaced. Corrosion also increases the amount of mercury vapor a dental amalgam device releases, so if you've got braces, beware. Dental professionals. In addition to their direct contact with mercury, dental professionals who work in offices that use amalgam also face high levels of mercury in the air they breathe. As a result, dental professionals including dentists, dental hygienists, dental assistants, and office staff are at particular risk. Studies have shown that they have elevated systemic mercury levels. Since many dental professionals are women of childbearing age, they are especially susceptible to the reproductive hazards associated with mercury exposure. Child dentist. Tooth damage associated with amalgam. On top of the risks of mercury exposure, amalgam is not even good for teeth. Oral health damage. Amalgam can harm your oral health by damaging tooth structure during placement. Placing amalgam requires the removal of a significant amount of healthy tooth matter. This removal weakens overall tooth structure, which increases the need for future dental work and the costs coming out of your pocket. Cracking teeth after placement. After placement, amalgam fillings expand and contract over time. As a result, these teeth can crack, leading to still more dental work. Superior modern alternatives to amalgam preserve healthy tooth structure and actually strengthen teeth, leading to better oral health and less extensive dental work over the long term. Tooth after amalgam fails. Environmental problems associated with amalgam. Mercury amalgam dental fillings have an impact far beyond your mouth. They are one of the most significant sources of mercury pollution today.